Parathyroid hormone is regulated by negative feedback mechanism. Parathormone secretion is increased by decreased blood calcium level, increased blood phosphate level, mild decrease in serum magnesium level. Its secretion can be decreased by increased blood calcium level, decreased blood phosphate level, and severe decrease in serum magnesium level. The main role played by parathormone is as follows. You can see here, when the blood calcium level is decreased, it is sensed by the parathyroid gland and there is increased secretion of parathyroid hormone. This parathyroid hormone will increase bone resorption and calcium efflux. Then in the kidneys, it will increase the secretion of 1,25-dihydroxycholecalciferol, which in turn will act on the intestines to increase calcium and phosphate reabsorption. Parathormone also acts on kidneys to increase calcium reabsorption and decreased phosphate reabsorption. All these will eventually result in increase in blood calcium level. Moving on to applied physiology. Hypoparathyroidism is caused by surgical removal of parathyroid gland during thyroidectomy, or it can happen due to removal of parathyroid glands, that is parathyroidectomy. It can also happen in autoimmune diseases and pseudo-hypoparathyroidism. It causes tetany. Hyperparathyroidism can be due to a tumor. In that case, it is said to be a primary hyperparathyroidism. It can be secondary due to hypertrophy in response to hypocalcemia, or tertiary due to hyperplasia. The signs and symptoms include depression of the nervous system, reduced ST segment and QT interval in ECG, and constipation. What is tetany? It is caused by hypocalcemia, as in hypoparathyroidism. This will result in increased neuronal excitability, which causes hyperreflexia. Some of the signs are Vosteck's sign and Trousseau's sign. Carpopedal spasm or Trousseau's sign is characterized by flexion at wrist, flexion at metacarpophalangeal joints, extension at interphalangeal joints, and adduction of thumb. People with hypocalcemia can have dry skin with brittle nails, and there can be hair loss. Vosteck's sign can be elicited by tapping the facial nerve on one side of the face. When it is tapped repeatedly, it will result in contraction of the facial muscles on that side. This happens due to irritability of the facial nerve. Trousseau's sign can be elicited by tying a cuff and occluding the blood flow. When this is done, it will result in carpopedal spasm. This is called Trousseau's sign. Another hormone that plays an important role in calcium metabolism is calcitonin. It will cause hypocalcemia and hypophosphatemia. It is secreted by C cells or parafollicular cells of the thyroid gland. It is regulated by increase in plasma calcium level. Its main actions are, it will decrease bone resorptive action of parathormone, and it will increase the loss of calcium and phosphate in the urine. It is used to treat hypercalcemia. Calcitriol or vitamin D is another hormone that plays an important role in calcium homeostasis. The active form of vitamin D3 is 1,25-dihydroxycholecalciferol. It actually enhances calcium reabsorption by several ways. It increases calcium binding protein in the intestines. It also increases calcium stimulated ATPase and alkaline phosphatase. All these will result in increased intestinal absorption of calcium, causing increased plasma calcium ion concentration. Clinical significance of vitamin D3 is that its deficiency will result in what is called rickets. It happens in children, leading to inadequate mineralization of the bone. Some of the common causes of rickets and osteomalacia are low dietary intake or inadequate synthesis in the skin. There can also be reduced absorption from the intestine. This can happen in people with intestinal diseases. Some renal diseases which can cause rickets or osteomalacia are chronic renal failure, dialysis-induced bone diseases, and renal tubular acidosis. The clinical features of rickets include the following. Pigeon chest or pectus carinatum. It happens due to flattening of the thorax and prominence of the sternum. Development of nodules seen in the costochondral junction in the ribs is called rachitic rosary. Then we can have spinal deformities such as kyphosis, which is referred to as forward bending. Then there can be lordosis, scoliosis, which is lateral bending of the vertebral column. Then Harrison sulcus is the groove which is seen in the rib cage due to pulling of the diaphragm. Then rickets can present with tetany. In this picture, you can see various clinical features seen in rickets. There can be delayed closure of fontanelles and wide sutures in newborns. There can be frontal bossing. There can be dental hypoplasia and spinal deformities, which I have just told you. Then rachitic rosary and pectus carinatum can be seen in the thorax, and you can see the Harrison sulcus here. There can be widening of elbow and wrist joints and knee joint. There can be associated swelling of the wrist joint. The abdomen can be protruding. The stature can be short with bowing of the legs, and there can be swelling of the ankle joint as well. Moving on to osteomalacia, rickets in adults is called osteomalacia. They can present with generalized body ache and muscular pain, resulting in having painful joints and muscles. So that's all about parathyroid gland and calcium metabolism. Thank you and have a nice day.